Good morning everyone. Myself Dr. Shantanu Prakash Agrawal, Scientific Secretary of GP Association. Today we all have gathered here as a part of our regular morning CMEs and the topic for today is yoga. आजकल के ज़माने में योगा से हर कोई अवगत है और लगभग हर कोई योगा कर रहा है. सब लोग अपने हेल्थ को लेके काफ़ी वरिड हैं. 2 साल से जब से कोविड हुआ है तब से ये चीज़ और ज़्यादा आप लोग के इसमें पॉपुलर हो गई है पब्लिक में. तो इसी को देखते हुए आज हम लोगों ने ये टॉपिक रखा है योगा, कि ये हमारे लाइफ में कैसे कैसे चेंजेस ला सकता है और क्या क्या कर सकता है. इसके लिए फॉर दिस टॉपिक नाउ आई वुड लाइक टू इनवाइट डॉक्टर विवेक चंद्रा who will give a detailed knowledge about this. Thank you.
So today we'll be talking about lifestyle modifications in non-communicable diseases, and we'll be talking about yoga little bit. So today's discussion is based on, is it time to expand our approach? When yoga comes, all of us think about something because all of us are very familiar about yoga. Everybody knows about yoga. So immediately what comes to our mind is certain postures and what yoga is to be done for what problem, this particular posture for that particular problem. So I'm not going to talk about any of these things because that is all known to us, because I was asked whether we have to bring our mats and pajamas for this topic, but that's not the case here. So firstly, I'll just chart down the progression of the talk. So to bring things into perspective, we'll be talking about the expansion of our approach based on non-communicable diseases. So firstly we'll define the non-communicable disease, then we'll talk about certain specific topics which are somewhere related to yoga, which will help us take care of our own health, because when our own health is in a better shape, then we can do better justice to the patient health also. So non-communicable diseases. So first we need to define them. So they are diseases like cardiovascular diseases, malignancies, diabetes, chronic respiratory diseases, and these affect all age groups across the globe, and their prevalence is on a rise in the modern era. And lifestyle patterns are mainly responsible for non-communicable diseases, and specifically now recent studies and surveys have shown that it is more so prevalent in low and middle income countries, and that's where our country pitches in. Physical inactivity, alcohol, tobacco, poor dietary habits, stress and ignorance all predispose to non-communicable diseases. This leads to approximately 38 to 40 million deaths each year, and that counts for 71% of the deaths globally. And on this red portion we can see that mental health disorders also, although they are on the bottom, but they are not so least important. Now here is a busy diagram on the part of the slide, but the summation writes there is that chronic stress results in maladaptive activation of the hypothalamic pituitary adrenal axis and the autonomic nervous system. The autonomic nervous system regulates the parasympathetic and the sympathetic systems. The parasympathetic systems, that is the rest and digest, and sympathetic, which is the fight or flight. Now I'd like to share a small story before we go on to this slide. Once there was a lady psychologist somewhere in the US, and she was addressing a gathering, and she asked a question. So she said, I'll ask you a simple question, and she took a glass half filled with water. And the moment she raised it up to the audience to ask the question, many people would already know that she would be asking whether the glass is half full or the glass is half empty, and that was the preset in our minds. So she immediately asked, can anybody guess what's the weight of the water and how would it impact me? And that was something new. So it took most of the audience aback, and that people started making random guesses. Somebody said it's 10 grams, somebody said it may be 100 grams, and somebody said 200 grams, like that. So what she summed up there was, it is not what the weight of the water is important, it is how long do I hold the glass of water will have consequences on my health. So, if you hold the water for a couple of minutes, it doesn't make a difference at all. If you hold it for a couple of hours, you might have a bit of soreness in your hand or something, but if you hold for the entire day, it may have dire consequences on your health. It can give you anything from a frozen shoulder to anything. The summary what she wanted to emphasize was, if we make a single subtle non-acceptable lifestyle irregularity on one particular day, it might not harm us. If we do it for a certain more number of days, it may have slight impacts on us. But in case we do a certain lifestyle irregularity for a longer period of time, that is going to have dire consequences. Even chronic stress can have dire consequences for us, because we see through the progression of this slideshow that lot of non-communicable diseases, they are inculcated from certain lifestyle irregularities which happen for, see, like for example, in our clinical setups, we are very much used to wrong postures. We sit in the chair and then we are in the chair for long hours, and a simple wrong posture gives you a long term knee pain or a lower back pain, which doctors, they just, after their OPD, they just go to the physiotherapist, get a shortwave diathermy, that they are done for the next day. But where did it come from is the main question. Where did we go wrong? So, coming back to the slide, metabolic risk factors such as obesity, hyperglycemia, hyperlipidemia and hypertension are some more predisposing factors for non-communicable diseases. Raised blood pressure. Now, this is slightly important, because blood pressure is our day-to-day clinical thing which we see. 19%, it's a big number, 19% of the global non-communicable death data comes from raised blood pressure levels. Take a moment to imbibe, because blood pressure is the first thing in the clinical setup. As soon as the patient walks in, we are eager to know the blood pressure before we take any decisions in any verticals of our specialty. So, we have to know how much it is contributing to the non-communicable death data. So, now the problem is coming from the community. It has to be solved with a community empowerment approach. A community empowerment approach can encourage community participation, which in turn may improve the citizens' knowledge of the danger and impact of non-communicable diseases. Yoga is a highly attractive as a means to promote global well-being while reducing healthcare costs. All of us know it comes free of cost, isn't it? But it takes time and energy to overcome the lethargy which is associated of not doing it every day. Because everybody knows what is good for me, but how many times do we take that extra 30 minutes off the bed to get up early and do something for us? Now, whenever we talk about yoga, immediately we can imagine some certain celebrities who have been doing certain physical postures and certain rapid stroke breathings, which Kapalbhati, for example, and those are the things which we usually talk about when we are talking about yoga. But that is not quite acceptable to the Western audience, because they associate it with a particular religion, they associate it with a particular way of life. But what I am trying to emphasize here is that yoga is a very, very scientific thing which is above the common idea of what we have about yoga. So, yoga on this slide is that it is a practice to unify the mind and body through coordinated breathing. So, that is one important pillar of yoga, that is coordinated breathing, which is known as pranayama. And the second is movement or posture, which is the asana, which usually we think about yoga. And meditation or dhyana is to achieve a complete integrity of your mind and existence with the unification of the surrounding. You call it God, you call it the environment, you call it your synchronicity with nature. So, that is what is important in the practice of yoga, and this certainly promotes well-being and reduces stress. Now, speaking of stress, we have to deal it with every day. So, it is important that we relax ourselves back. Now, this slide, well, to bring it into perspective, whenever we see the patient in our clinical setups, as soon as the patient walks in the chamber, there are three things which come into operation. One is the patient with his diseases, second is the doctor with his abilities and his skills and his knowledge and the research papers he has gone through and all whatnot he has gone through, and also is an invisible subconscious of the doctor, which if it is occupied with something else, it impairs your judgment, it impairs your capability, and which if it is free and it is meant for the betterment of the patient has different implications altogether. So the human body is not just a stabilized state, it is a possibility. So if you remember this and if you remind yourself this, so every patient that you come across, you know that what complaint he comes with and what is the possibility on either sides, on his recovery and also on his problems. So understanding the mechanics of whole life in totality can be achieved through yoga. Now here I am shortly talking about metacognition. So metacognition is when, as I mentioned, when the patient is there, the doctor is there, the doctor's subconscious is there. Now when you are making yourself aware to watch your subconscious decisions, that is metacognition. So metacognition is when consciousness steps in. So we cannot limit our understanding to the physical self, because the patient comes with so many thoughts in his head, and once we cannot get through, we look towards somatization. So that's not quite fair. We have to take a step between and find out some things which so it says that the way out may be traversing the path within. So if you are actually looking into something about your personal care or your patient's care, so many a times you may not find quick solutions on the outside. So if you look inside, you may find better care for your patients. Now my previous employers, the NHS, National Health Services in the UK, have included yoga in the treatment approach for mental health and physical conditions. That calls for a big scientific evidence based, because UK they are used to doing evidence based medicine, and when they include yoga for mental health and physical conditions, it is time to be happy about our own ancestral knowledge. So it has proved its value in palliative approach and supporting cancer care as well. Global pioneers such as United Nations and the WHO are looking at yoga as an inexpensive modality for all ages and stages of health management. Mind you, all ages and stages of health management. Now with situations like pandemic which we are going through in the COVID-19 pandemic for the past 2 years, we know that the number of people having mental traumas and the number of people having more aggravated stress, the reactions of people have changed. Our own people, our own friends and neighbors, their own irritability has gone up for no evident reason. But this is to be taken care of with an inexpensive modality. Now this is a busy slide talking about the benefits of yoga. So here the blue tabs, they are not quite clear, I will just read them across. So yoga has a potential to improve cardiovascular health, to reduce glycemic levels, to enhance physical fitness, to reduce back pain and to enhance sleep quality, also to decrease stress, anxiety, depression, and to strike a better balance and cognition in the elderly. Because as we age, the moment we cross 60s, balance becomes a consideration which would not have been there till maybe 59 as well. So when you start visiting the ENT specialist and the orthopedics for stability of gait, there is a good time to think of yourself to cool down your own system using yoga and to create a more sustained balance, so that your cognition and balance becomes better. So the potential of yoga was acknowledged at the United Nations General Assembly to address mental global health crisis. So that the global factor also configures in here, and encourage a worldview of peace, sustainability and responsibility. So that quite opens up a lot of promise on the same aspect, where healthcare is just a part of it. So the human body is at its best when allowed to function in complete sync with nature and fueled by balanced nutrition and rest. So there are a couple of pillars on this line. The human body is at its best when allowed to function. So you have to firstly allow your human body to function. Because we think that where do we cause an hindrance to our own health? We are just taking care of our health. But the moment you get up in the morning, the first thing is you log on to your mobile phones, you check your emails, you check your WhatsApps. There you are not allowing a possibility of yourself. Because had it not been these electronic gadgets, you would have got up, you would have met your family members first, you would have gone for a small walk, you would have taken fresh air, but now you are taking your WhatsApp, you are taking your email, so you are not allowing the possibility. So first is there, then there is the second part, the second pillar is the complete sync with nature. So complete synchronization with nature is advised. So go out for a morning walk, it really helps. Take a whiff of fresh air, talk to your friends, talk to your family members, that makes a big difference. And it should be fueled by balanced nutrition and rest. Now this is an important catch line here, because today we think now nutrition, talking of nutrition between us is useless, but we are all over in calories, we are all overfed in calories, but we are all malnourished and undernourished at some place in time. Look at the number of findings of fatty liver grade 1 on ultrasound. That shows your number of over calories that you are taking in and your body is not requiring them. But look at the nutrition side, everybody is popping in a multivitamin and somebody is having a D3, somebody is having a B12 deficiency. Why does this come up so often? We are all taking good care of ourselves, we are having proper meals. Why does vitamin D configure so commonly in our clinical day-to-day practice? Why does B12 deficiency come in on? Because we are taking a lot of calories which we do not require at some stage, which goes as an overburden to the liver, but we are not taking adequate nutrition and rest. So that's one point to make here. Now for all those who are waiting for the number of slides to over, it's just 22 slides and we are almost done 75% of it, because when I sit in the audience I always think how many slides are remaining, so not much. And we have a very small hands-on session there. I'll talk about it in a couple of seconds. So this is one of the last slides that bothers you. Yoga is not only about twisting the body, it is attaining the state where everything is one. So if at all you are looking for a take-home message from this talk, I think this is adequate enough, that yoga is not only about twisting the body. It is about attaining the state where everything is one. The farther we go from this fact, so if we go away from this fact, the more dissociation from the supreme state of oneness, the more is the possibility of a state of disease, that is dis-ease. So I'll repeat this part of it. So the farther we go from the supreme state of oneness, the more is the dissociation and the more is the possibility of the state of dis-ease, which is disease, more so technically non-communicable, because you keep it to yourself, you don't give it to others, although you can transmit stress to your family members, that we all know how to do it. So yeah, we have a technical snag, should have been a hands-on slide here, which for some reason it's not coming up. So if you are interested, we can go for a small 5-minute session on a hands-on technique, which you can give me your feedbacks later. If kindly close your eyes, sit back upright, let go of your stress, kindly close your eyes and do not open till the time you are requested to. Keep your knees, thighs, shoulders parallel to each other. Keep your spine straight. Take a deep breath in. Gently exhale. Gently inhale. Gently exhale. Now imagine you are sitting beside the sea. Now visualize sea waves coming to you. You are sitting on a patch of green grass beside the sea, on the sand. Feel the air coming to your face. Start to feel relaxed, bit more eased out. Now you are looking at the waves. You are feeling happy. Now you feel you are rising a certain 5 inches above into the air. still you can see the waves, still you can see the sand around and the patch of green grass. Inhale, gently exhale. Now you rise a certain 10 feet above the ground. Now you can see the waves coming. Now you can see the sand and the patch of green grass where you were sitting. You're feeling relaxed. Cool wind coming to your hair. You can now rise above a certain 10 feet in the air. Now everything starts looking small. The sea looks small, the sand looks small, the grass looks small. You can see into the vastness of the sky, a perfect blue sky, beautiful breeze of air. A gentle smile comes on your lips. A gentle smile comes on your lips. You are feeling easy. You are feeling relaxed. You are charged up for the day. Keep your eyes closed. Keep your eyes closed. Inhale. Gently exhale. Now, without opening your eyes, you come back to your chairs. Keep your eyes closed. Now you are back to your chairs. Take a deep breath in. Exhale, feeling more comfortable and happy. You're feeling happy now. Now without opening your eyes, gently rub your hands, rub the palms of both the hands and touch your face or eyes. And now gradually open your eyes. Thank you. Thank you for the journey and thank you for allowing me your time.
Stress afterward, then definitely it is going to cut your lifespan. And how it happens? And the thing is your thought. Whatever you think, that affects your mind and that produces cortisol. As Dr. Vivek Chandra has said, that when you think your prefrontal lobe, that is the main thinking process, that goes to hypothalamus. And from hypothalamus, you release CRH, corticotrophin releasing hormone, and that reaches to pituitary. And pituitary initiate ACTH, and ACTH goes to the renal glands, which are at the apex of here, and that releases cortisol, and cortisol dissolve in your blood, and that causes. Cortisol is not just a harmful thing; it is a beneficial thing. It is a corticosteroid, sort of a steroid. Steroid is anti-inflammatory in your body, and it produces a lot of glucose in your body, so prepares you for flight or fight response when there is a stress. But if it is chronic stress, then definitely it is going to cut your lifespan, and it will cause all diabetes and heart disease and all this communicable disease. So first thing is, as in yoga, it is a sort of what you do meditation, and what you do in meditation, there are so many thoughts. Approximately 60,000 thoughts come per minute in your mind, and most of them are negative and they are useless thoughts. So you have to control that thoughts, because it is an after effect of that. You are thinking, that is a short-term memory, you are thinking in the prefrontal lobe, and that goes to hypothalamus. So whatever you feed to your hypothalamus, that is the main thing. So what is the thing? Every time you are sitting here, and you are thinking something about your clinic, about अभी बच्चे को यहाँ पहुँचाने जाना है, यहाँ जाना है, तो there are so many questions in your mind, and some are stressing, some are not. So thought, like meditation, there is a thought meditation. In thought meditation, you just don't avoid any question. In meditation, you just avoid clutters. You focus on something, as Dr. Vivek Chandra has told, that before doing that, you must have been thinking about something, about your clinic, or going just, it is late or not late, something. So you are thinking so many things, and that were coming in your mind. But just you started doing that. So you just focused your attention on your breath, your body, and just forget. Just forget what was previously going in your mind. And that was beneficial but for that time. But after that, it was over. Again you are stressed. And that is because of your thought. So what you have to do in thought meditation, that you don't just go away with your thoughts like this, focus, stop. You just prioritize what is coming in your mind, because there is certain thing which wants answer. जैसे बच्चे का फीस है, या यहाँ जाना है, वहाँ जाना है, everything wants a answer. If you provide a suitable answer, then it will not come, it will not take. Otherwise, it will go on haunting your mind. Every time you are sitting here, it is haunting. It is you are going cleaning, it is haunting. मान लिया PNDT की नोटिस आ गई, इसकी नोटिस आ गई, इसकी नोटिस आ गई, तो every time it is haunting your mind. So what you have to do, you sit down and whatever comes to your mind, write down or just write in your mind and prioritize it. That this is useless time, this I can do in this span, and give an answer. Give an answer to every question. Ki this I will call to my advocate and he will do it. तो like this you free your mind. आपके जो थॉट हैं वो आप फ्री हो जाते हैं. जिसको जब आंसर क्वेश्चन को मिल जाता है, दैट विल नॉट रिकर इन योर माइंड, दैट विल नॉट हॉन्ट योर माइंड. सो यू विल बिकम परमानेंट. मतलब दिस जो मेडिटेशन दिस ये जो है टेम्पररी है, बट थॉट मेडिटेशन से आप कम से कम जो क्लटर आ रहा है आपके दिमाग में वो काफ़ी कुछ कम हो जाएगा. और दूसरी चीज़ ये है कि आप जो है अपने दिमाग को पर्सनली अलॉट कर सकते हैं एंड गिव ए टाइम दैट इज़ कॉल्ड वरी टाइम. You just provide a mind that 6 to 7 is my worry time. I'll worry, every worry is there. You are sitting in the clinic, you are going here, so something is coming, oh, I will think it in worry time, 6 to 7 a.m. So it will not come because you have shifted. And second thing is about exercise, yoga exercise. Yoga से मतलब ये कि that is just, Vivek Chandra says, योग, it is a word yog. Yog means union of mind and body. Mind and body union is called yog. This yoga has come from this word yog, संस्कृत के योग धातु से. तो अक्सर लोग पूछते हैं और आते भी हमारे यहाँ, जैसे नॉन कम्युनिकेबल डिजीज में स्पॉन्डिलाइटिस बहुत कॉमन है, क्योंकि लोग अक्सर घंटों बैठे रहते हैं, और स्पॉन्डिलाइटिस बैक की भी और जो है नेक की भी. नेक में हमारे यहाँ रोज ही आते हैं सर्वाइकल के केसेस, रोज ही 4, 5, 6 तो आते ही हैं. तो उसमें C4 पे, C4-5 पे जो है स्पॉन्डिलोसिस मतलब ऑस्टियोफाइट से पोस्टीरियर लिपिंग. C5 वर्टिब्रा इज पोस्टीरियर कॉजेज पोस्टीरियर लिपिंग. मोस्ट ऑफ द केसेस आई हैव सीन इन माइन. या आप भी करा लीजिए आपने काफ़ी लोगों में, क्योंकि आप काफ़ी देर तक बैठ के काम करते हैं या झुक के काम करते हैं. तो C5 जो है दैट इज मोस्ट इफेक्टिव वर्टिब्रा. यानी लंबर L4 पे पोस्टीरियर लिपिंग अक्सर मिलती है. आप देखिए अगर 10 लंबर स्पाइन देखेंगे तो आप गौर कीजिएगा L4-5 पे. तो हमारे क्लिनिक पे कुछ लोग आते रहते थे, थोड़ा सा ऐसी जस्ट हैबिट भी है, मैं भी करता हूँ. एक डेविड एडकन ने बहुत पहले एक्सरसाइज बताया था कि जैसे आप यहाँ खड़े हैं अपने क्लिनिक पे बैठे हैं, कुछ मोहम्मदन लेडीज़ ने कहा कि हम तो कहीं निकल ही नहीं पाते हैं. तो मैंने उनको थोड़ा सा सजेस्ट किया और मैं करता भी हूँ. और वो एक तरह से 5 मिनट वो कहीं भी कर सकते हैं. आप अपने क्लिनिक पे बैठे भी हैं तो भी कर सकते हैं. लेडीज़ हैं वो अपने कहीं बाहर नहीं निकलती हैं कमरे से, वहाँ भी कर सकती हैं. और ये एक तरह से आपके सर्कुलेशन को जो है, जो हैम्पर हो गया आपके बैठने की वजह से, गर्दन की वजह से, वो उसको रेगुलेट कर देगा. या जो लोग कहते हैं बस योगा करना इस समय करेंगे, सुबह करेंगे, शाम को करेंगे, इसके लिए कोई ज़रूरी नहीं है. आप कभी भी कर सकते हैं. अपने क्लिनिक पे बैठे हैं, 1 घंटे आपने पेशेंट देखा, यू कैन डू इट फॉर 5 मिनट्स. लेडीज़ जो मोमडन है या और कोई भी है नहीं कही जाती हैं, उनको बताया हमने, एंड दैट वाज वेरी बेनिफिशियल टू. तो वो मैं थोड़ा सा आपको डिमॉन्स्ट्रेट करना चाहता हूँ. your lung and your heart. Everything will massage. You start like this. आपने 1 घंटे काम किया, दरवाजा बंद कर दीजिए और पहले 5 मिनट के लिए छोड़ दो. उसके बाद you start like this. अब इसमें आपका ये शोल्डर खुल गया, सर्वाइकल खुल गई. इसके बाद आप ये एक्सरसाइज वेरी इंपॉर्टेंट. इसमें क्या हो रहा है कि स्पाइन मूव हो रही है, हार्ट बीच में है, लंग दो साइड में. आपका लंग हार्ट को प्रेस कर रहा है. इट इज प्रेसिंग योर लंग हार्ट एंड यू आर गेटिंग मसाज ऑफ लंग एंड एज वेल एज हार्ट. जस्ट डू दिस एंड this lung is pressing your heart, and do this pressing. So just take a deep breath and just exhale. ये आपकी ब्रीदिंग एक्सरसाइज भी हो गई और हार्ट और लंग का मसाज भी हो गया. इसके साथ एक मैं ये करता हूँ, इसमें ब्रैकेट के लिए जो है पर्टिकुलरली दिस इज फॉर ब्रैकेट. This just do for five times, just sufficient. Then ये circumflexion do for this. This is a complete exercise, and you just can do this like this. Back. अब इसमें आपका ये शोल्डर का एक्सरसाइज क्या हो गया, आपका हाथ जो है ऊपर उठा. जब ऊपर उठा तो आपका ब्रेन का सर्कुलेशन होता है. अगर ब्रेन के ऊपर अगर जाता है तो हाथ ये, तो यू आर गेटिंग सर्कुलेशन अबाउट. That is in your brain. We are improving the circulation of brain. Just, I think it has taken hardly 2 to 5 minutes. And you can do it. Anybody can do it. In your clinic you can do it. A lady can do it in, वो एक लेडी महिला जी कहें कि हमें तो घर में बंद रहते हैं, कहीं जा ही नहीं पाते हैं. हमने कहा ऐसा कि आप बेड से उठिए 5 मिनट, आप 10 मिनट कहीं गए कहीं 5 मिनट कर लीजिए और फिर आप रिपीट कर सकते हैं इसको. 1 आध घंटे बाद काम करने के बाद रिपीट कर. So you will get a little refreshment. You do it and you find refreshment. और जो आपकी जो ये disease है, जो बैठने की वजह से postural है, ये काफ़ी कुछ सेंटी हो जाएगी और जो सर्कुलेशन है वो आपका काफ़ी कुछ इम्प्रूव हो जाएगा.
तो हम मेडिटेशन के शुरू में, मैं तो 16 साल की उम्र की थी तब से परीक्षा ध्यान कर रही हूँ. तो उस समय हमको सिखाया जाता था कि बैठ जाइए, आँख बंद कर लीजिए. हमारे जैन धर्म में हम लोग अरहम बोलते हैं ओम की जगह, तो अरहम बोलिए. तो जैसे उसको स्टार्ट कहाँ से करते थे, नाभि से, मतलब इस केंद्र से स्टार्ट करिए, फिर आप आनंद केंद्र पे आइए, विशुद्धि केंद्र पे जाइए, फिर सीधा ज्ञान केंद्र पे चलिए. तो श्वास भरें, छोड़ते हुए ओम बोलते हैं. आप चाहे कितने सब लोग ओम अगर उच्चारण करते होंगे तो करें. ऐसे बोलते हैं ना, तो उसको आप यहाँ से सोचें कि ओम अ से ऐसे स्टार्ट होगा और यहाँ तक आके यहाँ ऐसे करें. आप 5 या 6 बार करिए. आप सच में कुछ क्या मतलब 50% बिना विचारों के हो जाएंगे. पर आपको कोई आलंबन लेना पड़ेगा. बिना आलंबन आप मतलब जैसे श्वास का आलंबन ले लें, चाहे कोई मंत्र जाप ले लें, चाहे ओम 5 टाइम्स डेली ओम कर लें. जब भी आप योगासन करते हैं उसके बाद बैठ जाइए, एकदम शरीर ढीला. और जैसे कि इन्होंने करवाया था, ये मैं डेली करती हूँ और वाकई ऐसा लगता है कि आप नदी के ऊपर तैर रहे हैं, पत्ते की भांति. पूरा ढीला हो जाए. 5 ही मिनट लगता है उसमें. बस ओम बोलते जाइए, रिलैक्स होते जाइए. और इसमें भी हमको सिखाया कि जब भ्रामरी करते हैं, भ्रामरी आप लोगों में से कोई करता है?
मैं जितने लोग करते हूँ.
भ्रामरी का एक सबसे सही तरीका, हमारे जो योग गुरु महाप्रज्ञ जी थे, उन्होंने APJ अब्दुल कलाम गए थे उनसे मिलने एक बार. वो हमेशा उनकी बर्थडे पे जाते थे. उन दोनों का बहुत अच्छी दोस्ती थी. तो वो बैठे हुए थे, वो करवा रहे थे. तो सिंपल भ्रामरी सब कैसे करते हैं बताइए आप.
अरे आप
हम लोगों के ऐसा मतलब लोग बस कान बंद कर लिए, भ्रामरी हो गई. हाँ, ये 5 बंद और टंग को आप मिडिल में रखिए और फिर सच में अभी करिए. आप उस समय एकदम निर्विचार रहेंगे, आपको लगेगा कोई थॉट नहीं आ रहा है. तो ये 2-3 ऐसी कंडीशंस हैं जिसमें कि, क्योंकि हमारे जो टीचर थे, हम उनके पास जब ध्यान सीखने जाते थे तो मैंने ऐसे ही पूछ लिया कि कैसे ध्यान करें, कैसे मेडिटेशन करें. तो उन्होंने एक ही लाइन बोली, करो और जानो. जब तक करोगे नहीं आप जानोगे नहीं. तो उन्होंने ये सिखाया कि आप जब सांस रोकते हैं, सांस जब रोक लेते हैं उस समय सच में कोई विचार नहीं आता। और ये मैंने प्रैक्टिकल करके देखा है कि आप सांस लें, रोक लें, आंख बंद करके करेंगे, उसे रोके रहिए। आप जितनी देर सांस रोके आपके दिमाग में कोई थॉट नहीं आएगा। ये मेरा मतलब पक्की गारंटी, आप करके देखिए।